Hi everybody, Dr. Emily here from the Evidence-Based Fitness Academy. I want to take a few moments to speak to you about scapular stabilization and shoulder joint stability. This is a teaser into our BTS Level 3, which is coming out in 2016. Now, a big thing that I speak about in all BTS courses is about spirals. And there's an upper body spiral as well, which leads to shoulder stability. We're going to go into that spiral now. Now, a lot of people will reference scapular stability as much more depression. So depress, retract the shoulder blades. I try to think about the shoulder blades as very much connected to the shoulder joint. So I actually like to create stability through a spiral that is actually connected to scapular depression or scapular stabilization. So many people are in an internally rotated position. We actually do a lot of our push-ups and planks and downward facing dogs in this internally rotated position. We actually don't even realize it. So we are creating or setting ourselves up for decreased shoulder stability and actually shoulder impingement. The stabilization that you want to create, or the spiral, is actually an external rotation spiral which is connected to scapular depression. So we want to think coming out of this internally rotated and elevated scapular position to a externally rotated and depressed position. Now, we're probably not doing a lot of this open chain, so we want to think about it closed chain. We don't want to just rotate our shoulders like this, but it's actually much more a wrapping of the shoulders down. So external rotation with scapular depression. From the side, it would be here. This would be your internally rotated position, and then we would do a wrapping or a spiral that includes the scapula. I'm going to show you a few exercises that I use to integrate this into my daily routine and into classes. So, starting with a push-up plank. Again, same thing. So you want to have shoulders over the elbows, over the wrist. And then I actually like to have in my classes that people set that scapular rotation or that spiral before they even come up. So, external rotation, the crease of the elbow is facing forward, shoulder blades are depressed, and then they're going to come up into that plank position. So they're going to hold here. If you want to add a little bit of fascial tensioning, you can push your fingertips down into the ground and hold that for 10 seconds. Okay? The way that you can add that into a downward facing dog and then kind of go from a plank to a down dog is the exact same thing. When you're in that down dog, a lot of people are actually in an internally rotated position, which sets them up for a lot of shoulder impingement. What you want to do is do the exact same wrapping of the shoulders. So there's that spiral that's out, trying to rotate so that the crease of the elbow is facing forward. Then we can actually transition from the down dog to a push-up plank, keeping that external rotated position. So planking here into our down dog, you're going to want to go into that initial internal rotation and then just wrap the shoulder blades back to find that stable position. And then we can go back, find the spiral out, exhale back, down dog, find the spiral out. Same thing translates into a push-up, where you want to start with that external rotation spiral. So we're going to set ourselves up, nice strong upper body, set the rotation here, perfect. And then you're going to come down. As you come back up, you want to really find that spiral. So spiral external rotated, we must internally rotate to come down, and then really spiral as we come up. Okay, last couple exercises are going to use either parallettes. If you do not have parallettes, you can make your own by using steps and weights, so the handles of the weights. So we're going to maintain that same spiral out. So again, spiral goes out, shoulder blades go down. We're going to hold here, and we're just going to simply lift the body weight off of the ground. Knees can stay bent. Remember, we don't want to be here. This is a very unstable position. We want to think of spiral out. Shoulder blades are going to go down. We're holding here. You can progress that into a plank where you're doing the exact same thing. So we're not here. Feel the spiral out. Tuck of the pelvis. We can go from this position, shoot through. So we're in an external rotated position here. Shoot through. Again, externally rotated. If you go into something like an L set, you're actually going to want to do the exact same thing.